Let's see.
Okay, I'm gonna join with my marketing email.
All right, Lamia, I think we are live, but we're seeing the attendee list start to rise.
Yes.
So I think we should give this a couple of minutes because it's not quite 5:30.
We should have some music playing in the background. We didn't think this through.
You know, I would volunteer your daughter, who sounds like a talented musician.
Thank you. Thank you. If she was here. Yeah.
We need a P-Long theme song.
I know. I have several in mind. There is some old, sex songs that we could be playing. But
Yeah, if anyone out there can think of a good theme song for P-Long, there is the theme from Shaft.
that might be a good
That might be that would definitely be a contender.
Yes, there's a George Michael song, an old George Michael song from the 80s that I'm thinking of.
Which one?
I Want Your Sex from.
Oh, that's good.
That's a good one. Um, we will get started soon, guys. We have over 100 people signed up for our webinar, so we just want to wait for a few more to log in.
What else?
There was another one by
I used to be a radio DJ. You know
I
that?
did not know that about you,
Yeah.
Mr. Brandeis.
When I was in medical school at Vanderbilt,
Yeah.
I had the first house and techno. This was before EDM was actually called EDM. It was just house and techno. I had the first house and techno
Oh,
radio show
yeah.
in Nashville, Tennessee. So
I
I'm
love
very, very
that.
particular about my music. And in the office, I actually have 7 Spotify playlists.
Well, we're getting some really good suggestions on our webinar chat.
Oh, nice.
There's Let's Get It On by Marvin
Oh,
Gaye. I
that's
like that
good.
one. That's a
Yes.
good one. The Long and Winding Road, someone
Ooh, I like that
else
one.
suggested.
That leads to your, isn't it? That leads to your heart.
Yes. I think it definitely leads somewhere. And but I did not know that tidbit about you. That's wonderful. So
Yes.
why did you quit the DJ business to go
Oh,
into?
because I really wasn't as, I'm a better doctor than I am a DJ.
Okay.
But you can check out, if you go to Spotify and put in BMD1, BMD2, all the way through BMD7, you can check out my playlist. I
That's
set it up
awesome.
so that in a month, I never have to listen to the same song twice. And I only listen to songs that I like.
That's awesome. I love that. All right, what time is it? It's
Let's see.
5:32.
I only give it 3 more minutes. The participant count
Okay.
keeps going up.
Okay.
So just a couple more minutes. Any other
Long View by Green Day. I've
oh,
gotten another suggestion here. I don't know that one, and I really love Green Day. I've seen them several times in concert.
hmm.
I have to look that one up. Um, there's another 80s song that I'm thinking of that I can't think of, but
Well, of course, there's Sledgehammer by Peter Gabriel.
there's that. That's a good one. Someone
Then
said,
there's, detachable penis.
yes, which we don't necessarily want that as our
Yeah, that
theme
actually
song.
may not be.
Probably not as good for our theme song. We'll leave that for Panuma.
Yeah, there you go.
Okay. So I think, do we need to start the recording as well, Dr. Brandeis?
I think we did.
When we went into the new webinar. Confidence by Ocean Alley. I love it. There apparently Aerosmith has a song called Big 10 Inch.
Doctor, I'm recording it right now.
Okay, great.
I hit record.
Thank you. Thank you. Okay.
Yes.
I think we should get started.
Fantastic. All right. Well, Thank you all for joining us. I'm Dr. Judson Brandeis. Just my credentials really quickly. I went to Brown University. I went to Vanderbilt for medical school. I did a year of research at Harvard Medical School, sponsored by the Howard Hughes Medical Institute. I did my residency at UCLA for surgery and for urology. I've been in private practice for 25 years. I've been voted top urologist in the San Francisco Bay Area for the last 14. And I do clinical research, um, not NIH earth-shattering clinical research, but really clinical research that matters, that's really important to people because I understand the pain points for people in clinical practice, and so I do clinical research for that, and that's where Pelong came from. And I am super happy to have Dr. Gabal with me. Dr. Gabal trained at UC San Diego Medical School. And hang on one second. Kat, can you turn your volume down? Sorry about that. I was getting reverb in my ear. She trained at UC San Diego Medical School and then did her surgical residency at UC San Diego and her urology residency at UC San Diego. And she is a board certified urologist. And she has been voted top urologist in Orange County for the past 17 years. So 3 more years even than me. So I'm really happy to have her on the webinar and also to have her as a Pelong provider.
Thank you so much, Dr. Brandeis.
So why don't we get started? Okay, so first of all, a disclaimer. I am not advocating for men to increase the size of their penis, right? That is entirely up to you. The purpose of the penis is to urinate and to have intercourse for the purpose of procreation. So if you can urinate and you can procreate, you have a perfectly normal penis. But just like 300,000 women each year in the United States get breast implants, not all of them have breast cancer. Sometimes people just want things for cosmetic reasons. And so the purpose of Pelong was, as a urologist and a sexual medicine expert and a surgeon, I would see a lot of the disasters from other penile enhancement procedures. And so if a guy wants a bigger penis and they're planning to take action, I wanted to provide a safe, effective, natural, and research-proven option. And so just to get to the end, before we start at the beginning, if all you wanted to do is to find out what are the results of the Pelong study and the Pelong protocol, you can grow your penis almost an inch in length and a half an inch in girth over a period of 6 months. And if you look at the graph on the left side, you'll see each month incrementally you'll increase the length and the girth just a little bit. So for length, it's about 2.5% per month. And for girth, it's about 1.5% per month. Okay, so those are the results. I didn't want to leave anyone in suspense, but now let's see how we got here. So in terms of penile enhancement goals, like ideally, what would be the best outcome for increasing the length and girth of a penis? First of all, it's got to be safe, and it's got to be safe both in the short term and in the long term. So for something, say, like pneuma, even if you get through the initial postoperative period without bleeding or infection, maybe 5, 10, 15, 20 years down the line, because you have this giant piece of silicone sitting in your penis, you're going to get an extrusion. You're going to get the skin on top of that big piece of silicone wearing away. And then all of a sudden, one day, you're going to see a little piece of silicone popping out through the skin. And that's a long-term complication. So you want something that's safe both in the short and in the long term. And you want something that increases both length and girth. So if you only increase length, you get what we call a pencil penis. And if you only increase girth, but you don't improve length or the size of the head of the penis, you end up with what I call a pig in a blanket penis, right? And pig in a blankets are great at cocktail parties, but they're not good in the bedroom. Then you want something that's natural looking. You want something that's symmetrical. You don't want your partner to say, "Ooh, what's that in your penis? Do you have filler? Do you have something in there?" You want it to just be natural. And you want it to be relatively inexpensive. So surgeries and fillers tend to be very expensive. P-Long, it's certainly not free, but as compared to some of the other treatment modalities, it's a lot less expensive. And then the bonus, the icing on the cake would be, boy, that would be great if it could improve erectile function. And so let's see how P-Long stacks up in terms of what the goals are. Okay, so size matters to men. I think it matters more to men than it means to women. What do you think, Dr. Gabal?
I mean, I would say I have to agree might be a minimum size that is, important.
Like
But
one of those rides, you have to be this tall to ride.
exactly. However, just like breast augmentation, I think most women do that for their own enhancement, and I think that's a similar idea for women, for men with penile size.
Okay, so in 2006, they actually did a survey, a body image survey of 50,000 men. And what they found is that half of all men overall desired a larger penis, and the other half were liars, maybe. Um, of the men, two-thirds of the men thought that they had an average size penis, but even amongst the guys that had average size penises, um, half of those guys wanted a bigger penis, and less than 1% wanted a penile reduction. And I've been practicing for over 25 years. I've yet to see a guy come into the office requesting a penile size reduction. I don't know
I
if
can
that's been
say the
your,
same thing. I can
yeah.
say the
So,
same.
okay, so the data is pretty consistent. Okay, now size varies, but everyone says, well, what is average? Okay, if you're in Cambodia, your average penis is less than 4 inches. And if you're in Cameroon, you better bring your A game because the average penis is 6.5 inches. In the United States, the average penis size is 5.3 inches. And ironically, in Iran, the average penis size is 4.7 inches. So I guess we know who won the war. That's the only political statement I'll make today. Okay, so growing penises, what do you have to do? Okay, the anatomy of the penis is two corpora cavernosa, which is where the blood fills when you get an erection, and one corpus spongiosum, which is where you urinate through, and that connects to the head of the penis, right? So really what you need to do is to increase the volume of the corpora cavernosa, and that's really tough to do because there's this stuff called the tunica albuginea, right? It's tunic. Tunic is like a covering. Albuginea is white, like an albino, and it's got two layers. So if you see on the top picture up here, there are two layers of the tunica. One gives you length, and the other gives you girth. And as someone who's done all sorts of surgeries, including vascular surgeries, where you actually open up the aorta, so I've cut an aorta open with an aortic aneurysm, I can tell you that the tunica of the penis is actually thicker than the aorta, thicker than the biggest blood vessel in our body. And so it's really hard to increase the size of the tunica, but it's possible, right? So when you're going through puberty as a young boy, your penis actually grows, which means that the tunica increases in size and increases the volume of the corpus cavernosum. The other challenge is that there's 2 points of connection of the penis. There's a connection to the pubic ramus at the very root of the penis, and also a connection to the suspensory ligament, which is basically under the pubic symphysis, under the middle part of your pubic bone. So you have to overcome not just the tunica, but also these points of attachment.
And if I can add, I usually explain the tunica also. It's very thick, like celery, very fibrous, and that is actually what breaks, tears during a penile fracture. That tunica albuginea, which is something no one wants to hear about. But
I'll never have another Bloody Mary without thinking about you.
thank you, the celery,
Yeah,
the celery.
celery, I like that.
It is.
All
It's
right.
celery.
So, how do guys try to increase the size of the penis? First of all, you can do traction, right? You can do what's called jelqing, which is kind of a sophisticated way of stretching the penis. Or there are some devices that you can wear during the day for 6 to 9 hours a day for at least 6 months, and there is a study or two out there showing that you can increase the length of the penis 1 or 2 centimeters by stretching continuously the penis. I don't have a job where I can wear a penile stretching device for 6 to 9 hours a day, but a lot of people are working at home these days, and that's just another benefit. In addition to no commute, you can do penile stretching all day if you want.
I agree.
Okay, another option is injection of fillers. So there's subdermal, which is just below the skin, and that is the uroscope technique, or the subdartos fascia, so between the dartos and the buccal fascia, and that's the urophil and the phallophil. And the problem with that is that it kind of squishes around in that space because it's a more potential space. But either way, these things only last between 6 months and 2 years. So up front, you have to pay about 10 grand to get your fillers placed initially, and then every year or two, if you want to maintain that girth, you got to pay another, I don't know, 2, 3, 4,000 bucks to get those fillers replaced. And it really depends on what filler you use. Most people use hyaluronic acid, which is a natural substance. I've seen some people use PMMA, which is a more permanent filler, but it almost feels like candle wax. And so a lot of people don't want a waxy penis unless you go to certain maybe wax museums in Vegas or something like that. Okay, anyway, that joke kind of fell flat. Suspensory ligament release, stay the hell away from people that want to do this, okay? Basically, you're not increasing the size of the penis, you're just basically making it hang lower. The problem is, instead of being at full mast, you're going to be pointing your penis, erect penis, down towards your shoelaces. And then what happens sometimes is you get scar tissue at the suspensory ligament, and then the penis actually becomes shorter. So this is definitely something I would not recommend. And then this is a picture of Dr. Elist, who developed the Pneuma implant. This is basically implantation of a silicone taco shell. There are significant risks of bleeding. I've seen that in some patients. There's significant risk of infection. I've had a number of patients come to see me that bad infections, and I had to get those removed. Pain. There are a lot of these that are being removed. There are a bunch of lawsuits out there. It's expensive. I'm not saying that everyone is a disaster. All I'm saying is that if you have a penis that you can procreate and urinate, even if it's 1 out of 20 or 1 out of 50, it's going to be one person. And you don't want to be that one person that takes a perfectly normal, healthy penis and messes it up. Okay, because of all these downsides and complications of other penile enhancement techniques, I decided, since I had a research background and I was in regenerative urology and it was kind of this growing space. I was a director of clinical excellence for Gainswave, and I was doing PRP, and I was working with Dr. Runnels. I decided, I'm the guy to try to figure this out. So I found 30 men with normal erectile function, right? You can't have erectile dysfunction. You have to have normal erectile function. I designed a 6-month study. I got it IRB approved. We were going to check your length and girth and function every month for 6 months. I got it listed by the NIH at clinicaltrials.gov. And it was quite a challenge to recruit patients for this study. It's not like you can use normal channels. Like a friend of mine owns Diablo Clinical Research. They recruited patients for COVID studies and cancer studies, but penile enhancement studies are a little more challenging to recruit for. You can't go out on Google, you can't go out on Facebook and recruit. So I had to use some more creative ways to find these patients. And we would get all sorts of interesting calls. One time I got a call from a guy, and he wanted to participate in the study. And I said, sir, you're in Ohio. And he said, yeah, but it's listed by clinicaltrials.gov. It should be sponsored by the NIH. And I was like, sir, The NIH is here to cure cancer and heart disease. They don't really care about penis size. So, but eventually we did get 30 men, or 30 plus men, 30 men finished the study. And I presented the data at the International Society of Sexual Medicine and the Sexual Medicine Society of North America meetings. And the protocol was that guys would use the RestoreX traction device 20 minutes in the morning, 20 minutes in the evening. The RestoreX was developed by a friend of mine at the Mayo Clinic for the treatment of Peyronie's disease, but we repurposed it for penile enhancement. We used the Dr. Joel Kaplan penis pump morning and evening for 12 minutes. We used double spin PRP, which is the secret sauce, right? So PRP contains growth factors, which accelerate the growth of tissue. And we did this once a month for 6 months. And then all patients took the Affirm nitric oxide boosting supplement, 2 tablets in the morning, 2 tablets in the evening, and that improved nighttime erections. So the more erections and the more stretching we could get during this time of traction, suction, and PRP, the better. And then we did measurements, length and girth once a month. And people are maybe interested, did we do bone press? Did we do non-bone press? It was really up to the individual as long as they did it consistently the same way. So this is the RestoreX device that we used for traction. This is the Dr. Joel Kaplan penis pump that we used for girth enhancement. And this is the Affirm nitric oxide booster that we use to improve circulation. And this contains citrulline, which then turns to arginine, which is a nitric oxide donor. It also contains beetroots, which contains nitrates, which convert to nitrites, which then convert to nitric oxide. And in the Confirm 2 study, we showed using the tech ring to check for nighttime erections that you can increase nighttime erections 34% by taking the Affirm nitric oxide booster. So this just shows that you improve nighttime erections, which improve the stretching of the penis during this protocol. And then platelet-rich plasma, for those of you who don't know what it is, what we do is we collect blood, we spin the blood down. When you spin blood down, the red blood cells are heavy, they go to the bottom. We remove the red blood cells. The plasma, which is basically just water, goes to the top. We remove the plasma, and then we take out the layer with platelets called platelet-rich plasma, or PRP, and we inject that into the corpora of the penis. I use ultrasound guidance, a single stick method, and I inject half, usually about 4 cc's on the left side, half on the right side, put a clamp at the base of the penis for about 10 minutes, and that makes sure that the platelets stay in the penis and release all their growth factors. Okay, so back to the results. There was no suspense. I wanted to put this up front. You can get almost an inch in length and almost a half an inch in girth over a period of 6 months. And it's a pretty steady increase in length and girth. But some people do not grow at all for the first 3 months and then catch up for the next 3 months. Some people grow more the first 3 months and less the second 3 months. There's really no consistency in that. And I did statistically look at whether there was a consistency in growth. And then this is the study that we published in Andrology Open Access, which is a reviewed journal. And this is available on the PLONG website, and it's also available online at Urology Open Access. But the important part of it is, this is something that I presented to my colleagues, academic colleagues from universities all over the United States, all over the world, to private practice colleagues. They had a chance to vet it, to ask questions, to criticize it. And it was published in a reviewed journal. So this really is the first time anyone's ever taken those lengths for a penile enhancement protocol.
No pun intended.
Exactly, no pun intended.
Mm-hmm.
So to conclude, most men have penis length adequate for intercourse and urination. there's a low satisfaction with traction devices, suspensory ligament ligation, Eolist implant, fat grafting. Hyaluronic acid is commonly used for penile girth enhancement, but it is expensive and it has to be redone every couple of years. The pneuma and suspensory ligament ligation have shown to have had disastrous complications. Not every patient, but even if it's 1 out of 20 or 1 out of 50 or even 1 out of 100, you don't want to be that one guy. And the hyaluronic acid and the pneuma, they improve girth, but there's nothing that consistently improves length until now. So we talked at the beginning about like what would the goals be for a perfect penile enhancement procedure. So first of all, it's got to be safe. And in the 30 patients in the P-Long study, not one single one had a adverse event. And I did all of the PRP injections in that study. So all 180 PRP injections, not a single complication. And I'm going to, after Dr. Gabal speaks, I'm going to present data on the almost 800 patients that we have gathered data on that have undergone the P-Long protocol and to show you how safe this procedure actually is. We also want it to be effective. And so we can grow a penis almost an inch in length and almost a half an inch in girth over a period of about 6 months. We want it to be natural looking, so we want it to be symmetrical. So sometimes with fillers or with silicone implants, you can have this kind of strange, lumpy, bumpy penis, but a P-Long penis is a natural, normal looking penis. We want it to be relatively inexpensive, and P-Long is definitely at least half the cost of fillers or surgeries. And as an extra added bonus, because of the PRP, P-Long boosts function. In basically all the men that got the P-Long procedure, since you get 6 P shots or PRP injections to the penis, you got improvement in function. So I was super excited about this. I published the P-Long study, created the P-Long protocol, and then started to find other urologists and healthcare practitioners that could do P-Long in their neck of the woods, because I'm only in Northern California. And I've known Dr. Gabal for years. She's an outstanding urologist and a very innovative physician. And she was one of the earliest adopters of P-Long. And I want her to share her P-Long story with you.
Thank you so much, Dr. Brandeis, for having me on here. I'm excited to be able to share our experience at Prestige Medical Group. And let me just share my screen. I need to get to my,
Means I got to stop my share.
I think you do. Let me go back here. And
All right. I'm just going to check out the Med Fly girls first.
I know. That was
How do you
actually-
qualify to become a Med Fly girl?
That's a funny story, because in medical school, I'll tell you guys all of this as I'm trying to get back into our Zoom. We had a talent show, and that was back in the day of, can you guys see my screen I'm sharing? Am I sharing?
I
Okay,
could see it.
here we go. Okay. So so we had a talent show, and it was back in the day of In Living Color, where there was the Fly Girls, and it was
J-Lo.
back in the day of where we were Med Flies. I don't know if anyone remembers that. And so we kind of combined that all together, and we were the Med Fly Girls, and it was fun. We did a little dance routine. Yeah, it was fun. That was in a prior.
I'm gonna look for the video.
It may not be online. It may be before. It may be before things were online. All right. So thank you all for joining us tonight. We have so many people who are here, and then we're recording it also so that people can watch this after. And we
I
really
think this is the most attended webinar I've ever participated in.
I know. I
It's
think
very
it's
exciting.
wonderful. It is exciting. And I love teaching people about this, because I actually had a patient the other day who said, "This seems too good to be true. why isn't every man doing this? And I said, because they don't know. They just don't know about it. And so we are spreading the word. We're spreading the gospel. So a little bit about me. I am board certified, double board certified in urology and subspecialty in female pelvic medicine and reconstructive surgery, which, makes me an expert in both penises and vaginas. And I do lots of different types of reconstruction. And I think it gives me a different perspective on the aesthetics of the penile enhancement. So I appreciate being here today. And we offer lots of different things at my practice at Prestige Medical Group in Southern California, as you can see from here. And as Dr. Brandeis mentioned, I have been voted a top doctor in Orange County for the last 17 years, and I was awarded the cover a couple of years ago. So
Wow.
that was lovely. I know. So when
They
Dr.
wouldn't give
Brandeis,
me the cover.
they maybe now,
Yeah.
I don't know. So when Dr. Brandeis first came to me with this idea, I started out a little bit skeptical. Like as he said, we've known each other a long time. Um, but there wasn't a lot out there that's available for penile enhancement. I was already a P-shot provider, which has been around for many years for platelet-rich plasma for erectile function. And so this is sort of a natural extension of doing P shots and extending it, pun intended, into penile enhancement. And so I thought it was a brilliant idea. And the fact that there was a study behind it was wonderful. And so I started slowly and we recruited a few patients who were interested. I always love learning new things. I love offering new things to my patients. I love learning new things for myself, and we want to live forever. We want to be active and vibrant and sexually active forever. And so, I think that this is something that's just been great to be able to add to our repertoire. But we did start slow. And our first few patients were super happy, just like we saw in the study. But they were very dedicated. They were not smokers. I have to say that I will refuse to do these on men who are smokers because their cells just don't respond as well as non-smokers. Nothing regenerates as well. So the first few patients, especially, we chose carefully and we had excellent results. So then we then rolled it out to more patients and we had lots of positive outcomes. We saw measurable and consistent results. Our patients are super happy and not just with their length and girth, but also with their function, as Dr. Brandeis had mentioned earlier. So the PRP, the platelet-rich plasma, helps to give those healing factors into the corpora cavernosa. We're rebuilding collagen, elastin, blood vessels, nerve endings, and then we're remodeling those cells using the stretcher and the vacuum device. We're training those cells to be longer and thicker. And when we add those healing factors, we get better results than, as Dr. Brandeis mentioned earlier, just the jelqing on its own. It takes much longer if you're just using the weights. And I have to say, it's been so nice to see this as a confidence builder for a lot of our men. Again, just like breast enlargement has been, breast augmentation, initially was available for women for cosmetic reasons, but it was sort of probably frowned upon. But now it's almost unacceptable if you don't have a boob job, especially where I live in Newport Beach. So, we want to get there with PILA. We want this to be so well accepted, and we want it to be so available for men in order to be able to build their confidence. So we did a targeted marketing launch to our male patients and also advertising, and it really has become one of the most successful procedures that we offer here at Prestige Medical Group. Over 100 men so far have been treated, either have completed or are in the middle still of their treatments. And I've been doing it for almost 2 years. I think we are some of the earliest adopters. Again, the average gain in length we've seen is about an inch. The average gain in girth we've seen is about a half an inch. And we do have a record holder, one top single patient who had an exceptional length gain, our overachiever, for an inch and a half.
I had a patient like that too, and he came to me one time. He's coming in for his PRP, and he said, "Doc, this is going to be the last treatment." I was like, how come you did so great? And he said, "Well, I talked to my wife, and she said, well, you're too big for oral, and you're too big for anal, and you need to leave at least one orifice open."
So
So
I guess
sometimes you can have too much of a good
there
thing.
is too much of a good thing. It
Yeah.
can be. It absolutely can be. And so you get to decide, the man and his partner get to decide on what is too much of a good thing. Um, and on that note, there's a couple questions that we get a lot in our practice. Number one is this permanent? Is this gain permanent? So, the penis and the vagina, for that matter, these are use it or lose it organs. And so if you stop using your penis, you will shrink. We have men that come into our practices, after not having erections for many years, and they will complain of size loss. And it's because there's no blood flow to that organ. Everything shrinks if there's no blood flow. But as long as you continue to use your penis, you will keep these gains. These gains are yours forever. And the corollary to that is, can we get more gains if we continue to do the protocol? And we have had several patients who've added another session of P-Long, and they've also seen very good results continuing. So to our earlier point, we don't know what the maximum is. We haven't gotten there yet, but there is continued growth, even with continually doing the P-Long protocol. So we do have some before and afters to share with you all. If you'd like not to see them, you can avert your gaze and we'll let you know when that photo is off. That is my next slide. So you can see in the first slide that patient one measured about 4.5 inches and went to almost 5.75 inches. Patient two, that was in length. Patient two went from about almost 5 inches in girth to 5.5 inches in girth. And then patient three went from almost 5 inches in girth to a bit over 6 inches in girth. So, sorry, about 5.5 inches in girth. So, we do get pretty consistent results with this treatment. So the slide is off, and I will stop screen sharing. Let me get back in here if I can to the Zoom. Sorry, guys, we are much better surgeons and urologists than we are IT guys. Okay, I think I'm no longer screen sharing.
Okay, cool.
Are we still there?
Let's see. I can still see your screen.
You can. Okay, it's not supposed to be sharing. Why can't I get it?
Okay.
Are you sharing?
Let me see, since I am controlling.
You are screen sharing. Stop share. There we
There
go.
we go.
Sorry.
Hey, excellent. No worries.
Okay.
But
For
in
those
the
of you who maybe
meantime,
didn't want to see
I
that
want
photo.
to remind all the folks that are participating to fill out the poll at the end, and that will get you $500 off from my office in Northern California and Dr. Gabal's office in Southern California.
Also,
And
put your questions in the chat if you have any
yes,
questions.
put your questions in the chat. So I'm just going to go over some really exciting results for a couple minutes, and then we'll answer questions. And I have a whole list of questions over here that we can answer. But doing this webinar kind of inspired me to get results, not just from Dr. Gabal's office, which, it's really exciting when you do clinical research. If something works in your hands, that's great, but you really want it to work in anyone's hands. And so it was super exciting to see that Dr. Gabal's results were very consistent with my own. And so then I queried all of the other P-Long offices, and 17 of those offices to date have replied. And so I can give you the data from those 17 offices. Now, it's not official data, right? Because I'm going to write this up for the Sexual Medicine Society of North America meeting to present it, and also to write it up for publication. So I can't give you the official data because I'm not supposed to do that when I'm presenting at meetings and writing up for publication. But what I can tell you is to date, we have 792 patients from 17 offices around the country, and the average gain in length is 1.01 inch, which is really remarkable. That we went from 30 patients in the P-Long study to almost 800 patients around the country. And the average gain in girth is 0.63 inches, so even better than what we got in my office. And a really exciting number is what percentage of patients undergoing the P-Long protocol had improvement in penile size, and that number is 88.5. So really about 9 out of every 10 patients that undergoes the P-Long protocol will get a positive result. And that, 90% is a really high bar. When you look at, say, shockwave therapy for erectile dysfunction or PRP for erectile dysfunction, it's nowhere near 90%. So it's really gratifying to see that the P-Long protocol has positive results on over 800 patients, or almost 800 patients around the nation. And the really, really exciting thing is that when we asked all these offices, have you had any patients with really negative side effects or any issues or problems, there wasn't a single patient that had any significant issues or problems. And so along those lines, we also asked what percentage of your patients continue after the initial 6 treatments, and the average for that was 18%. So basically 1 out of every 5 men who undergoes 6 treatments as part of the P-Long protocol will continue getting injections. We don't know if they get a full 6 or they get 1 or 2 or 3, but they're so happy with how things went that they wanted to continue. So that really is exciting data. I'm going to continue formalizing it. I'm going to present it at the SMSNA, and I'll write it up. Probably it'll be published by Christmas this year.
I think that's amazing. All of this is groundbreaking, and it really is the first natural method available for penile enhancement. So it's wonderful. We do have time for some questions, and I will take the first one. Hello, can I buy the protocol and use it here with the injections because I live in Europe, and the pump, I don't know if I can get it here. So unfortunately, this is something that, we can't just deliver to you. It needs to be given and administered by in the United States, it should be best done by a board certified urologist. You don't want to go to like the med spas on the corner that give you a big discount. When you're dealing with your penis, you don't know what you're getting. But it needs to be your PRP that's spun and put back into the penis. So it has to be done by a healthcare professional. And then the devices you can get online, but usually we recommend the ones that Dr. Brandeis recommends.
Yeah, and the reason that we chose the RestoreX device is that if you look at the data on the RestoreX device, they did kind of a head-to-head for Peyronie's disease using the RestoreX device and a suction-based device, and they found that the results from the RestoreX device are much better. In terms of the pump, we used the Joel Kaplan pump because it had a gauge that we could determine exactly what pressure we were giving. And then the PRP comes in all shapes and sizes, but if you're going to stick a needle in your penis, you want the best PRP. And so we draw 60 cc's and double spin. So you want to get the highest concentration of platelets, which for the pure spin machine that I use, which is an M-site machine, is about 6 to 8 fold concentration of platelets. So it really does. If you're going to put the time and the effort and the expense into doing the P-Long protocol, you want to make sure that what you're actually using is the best stuff. And people come to me all the time and say, well, what about adding stem cells? What about adding exosomes? What about this device? What about that device? And what I really simply say to them is, that's a great idea. Do the study.
Yeah, we just don't know yet.
There's so much anecdotal and marketing stuff out there. Everyone is out there hawking like this works, that works, the other thing works. Do the study, present it at the Sexual Medicine Society meeting, publish it in a reviewed journal, and then let other people do it, and then present the results of other people using your protocol. And if you check all those boxes, then you have something. But if you don't check all those boxes, then you're not there.
All right, the next question, maybe Dr. Brandeis.
Yeah, well, first of all, someone said there's a song by Aerosmith called Big 10 Inch.
Yes.
I have to verify that this actually exists, but I think that would be
Probably the winner.
the winner by far of our P-Long theme song. And I'm going to call up Aerosmith's representation to see if I can use that for our
I love that.
protocol.
And then I think the next question is down
Let's see.
about back in 2020. I got a procedure done with Dr. Loria in Miami, Florida. I got permanent filler in the shaft of my penis. Would I still be a candidate for the P-Long protocol? I'd be interested to hear what your answer is.
Yeah, so I have a number of patients like that in my practice, including one who got PMMA, and certainly these are still good candidates for P-Long. I tend to tell them not to use the pump for girth enhancement. We've got girth enhancement already, but it's a great way to actually get length that goes along with the girth. The one thing that I would encourage any P-Long provider to do in that situation is to use ultrasound because the anatomy is very distorted by the filler, and the only way to reliably get the PRP delivered to exactly where it needs to go is to use an ultrasound. And you can actually hurt someone by just pretending like you know exactly where the corpora is, because I've seen that before.
Well,
These
especially
patients can be really tricky.
and if it's not a urologist, especially who's not.
Yeah, I mean, anyone can be trained, and
Yeah.
that's a medical professional to do this
Yeah.
kind of stuff. They just have to be trained properly.
So that goes along with the next question. Can you combine P-Long and filler? And yes, you can. Some men choose to do that to get the instant girth from the filler and then the longer lasting length and girth from the P-Long protocol. And also it can help with Peyronie's, although we haven't studied that. But we do have anecdotally several patients who have Peyronie's disease, which is a curve to the penis. And there's also studies to show that just dry needling the plaque, the scar area, can help with reducing that curvature. And so for those patients, what we do is I will inject directly into the Peyronie's plaque and then adding the PRP along with the stretcher. We've seen some really good results for Peyronie's. I don't know what your experience has been, Dr. Brandeis.
Yeah, there's actually some good data out of University of Miami, and the University of Miami has a really good sexual medicine department, and they're very, very conservative and skeptical. So I was really surprised to actually see the data from Miami that the PRP actually had a positive improvement on Peyronie's disease.
Mhm.
In terms of someone asked, how long do you have to wait to have intercourse or masturbate? You don't have to wait at all.
Not at all.
Yeah.
That day. We want you to use your penis. I tell all my patients as soon as possible. So we want you stretching and vacuuming that day, and you can use it for whatever you want the same day.
Someone asked, if you have erectile dysfunction, will it still work? Not as well. And so if you have erectile dysfunction, come to the office and do some focused shockwave therapy. You can use daily tadalafil. You can do PRP for erectile function, M-Cell chair, a firm nitric oxide booster. There are all sorts of things that we can do to improve, regenerate erectile function, a penis pump. Once you get to the point where you're having good, consistent erections, then you're a good candidate for a P-Long. But if you can't fill the penis you have with blood, then how are you going to fill a bigger penis?
Yes, blood flow is key for a lot of the stuff, but it also helps to improve erectile function. So in the process, we do see more blood flow. So it may not be as effective, but it definitely is still effective, and it helps for function as well.
So let's see. Next question. I've been on P-Long for 3 months. I'm having a hard time finding time in the morning. If I stretch at the end of the day for 60 minutes, pump for 10 to 15 minutes, is it the same as effective as twice daily in terms of effectiveness? The answer is I really don't know. Most people's lives don't revolve around increasing the size of their penis. And so you just got to do the best you can. That's why a lot of the patients that I have for this are single guys or gay or, people that have the time. If you have 3 or 4 kids running around the house, it's really not the time to pump and stretch your penis.
You can hide it under a robe.
Yeah, you could.
That's what I tell my patients.
Let's see. Next question. How long has this process been around? For about 2-3 years. How long does the procedure last? As long as you're getting good erections, it should last for a long time. And how is this procedure viewed within the medical community? I think it's generally accepted. When I go to meetings, it's been very well received. I get very appropriate questions. I'm still a member in good standing of the American Urologic Association, and I'm board certified. And they usually let people know in no uncertain terms if they're doing things that they would consider rogue or inappropriate. And I think it's part of when you actually go and show your face and present data and write things up, I think it's much more generally well accepted.
It's becoming a lot more mainstream too. More people are talking about this kind of stuff. And there's a lot of universities, as you mentioned earlier, who do research using PRP. And so these things are becoming more mainstream.
Yeah. Another good question is, how does a provider qualify to be an official P-Long provider, and do they have to use the exact protocol? I can't go around offices and police people, but the providers that we have are, I think, honest, ethical people to the best of my knowledge, and are doing things in patients' best interest. And it's in the patient's best interest to follow the protocol that's been shown to work.
I think I would like to take the next one. Based on everything you've learned from patients since the study was published, if you had to describe your ideal candidate profile, what does that person look like? And what separates your best responders from your average ones? Well, I would say someone who's committed to doing the homework. I don't like doing this on someone who up front will tell me, well, I don't have the time to do the stretching and the vacuum, because it's just not going to work. You have to do the homework. You have to put the time in. Usually someone in their 30s or 40s, single, as Dr. Brandeis might have said earlier, because then there's less commitments that you might have to attend to. And then smoking, this gets to our next question as well. Any kind of smoking, vaping, marijuana. I am very against doing that with any kind of regenerative therapy, because it's not just the things that are in tobacco, which we know that there's vasoconstrictors, there's things that prevent blood flow to the tissues we're trying to regenerate, but the smoke itself inhibits the oxygenation to the tissues. That's why people get lung issues from vaping and also marijuana usage, and some of those are even worse than cigarettes with filters. I spoke with a patient today who I advised to stop his hookah usage, because I don't want that to interfere with the regenerative nature of what we're doing. And I want you to be happy. I want you to get the best outcome that you can, and I don't want you to waste your money on it.
Cool. In terms of downside risks, and has it been around long enough to know if it holds up in the long term? It's been around for 2 or 3 years. We don't get anyone coming back and complaining that there are any long-term problems at all. And like I said, in the 800 patients that we've now surveyed, none of them have complained of any significant issues. Let's see. Someone said at their, I won't say the name, but their clinic, they don't draw 60 cc's, but 30 cc's, but they still do double spin. I would just say, I would like 60 cc's drawn. The kits for the 30 cc's are less expensive than the 60 cc's, but if you're paying for a P-Long protocol, you should get the P-Long protocol. The P-Long protocol is a 60 cc double spin protocol. Like I said, if you stick a needle in your penis, you want it to work.
There's a question about Peyronie's. I think we answered that already. We just have about 5 more minutes till we get to our end time. So how important is a diet before using P-Long? I'm not sure I understand that. If you're talking about weight loss, it's not necessarily that important. If you're talking about eating healthy and clean so that your tissues can regenerate, I think that is also important, but it's not 100% necessary. You can still drink. Alcohol, though, can also impede some of the regenerative processes. So we don't want you to drink excessively. And we do want you to eat as clean as possible. Weight loss in and of itself can also give the appearance of a larger penis. So just alone, if someone is obese. And what else do we have?
Let's see. The cost of P-Long, it really varies by office. We can't set a price for people to charge. In my office, it's $7,500. And if you participated in the webinar, just sign up with your code or mention that you are a participant in the webinar and we'll give you $500 off.
Okay. And just a couple more questions. Does having very low body fat and minimal pubic fat pad affect how gains present and how they're measured? As long as the man is consistent with how he's measuring, whether it's from the pubic bone or not, then it won't affect outcomes at all. So that's not an issue. And I think the last one is for you, Dr. Brandeis.
So if you are seeing this for the first time and it was mentioned that it's only been around for 2 or 3 years, so not much history yet, would I do it? Personally, I can procreate and I can urinate. So that spending the time to do that wouldn't be important to me, but I can tell you, totally honestly, it's totally safe. We've never had even a small complication. We never had any issues whatsoever. It improves erectile function. I've seen all my patients that had this had improvement in erectile function. All my patients had improvement in girth and length. Some more, some less, but everyone had a fine result. The growth is symmetrical. So I started this and I'll end this with, I really don't care how big or small your penis is, as long as it functions. Don't do anything that will mess up a good thing. But if increasing the length and girth and function of the penis is important to you, this works and it's safe.
Yep, exactly.
All right. Well, thank you so much for everyone that
Thank
logged
you,
in.
everyone.
Wow, like we kept everyone pretty much
It
stayed
was
on the whole time.
wonderful.
It's
It
pretty
was
cool.
wonderful. I know.
And Lamia, thank you so much for participating with me and being an
Thank you for
outstanding
having me.
colleague and P-Long provider. And I look forward to finishing collecting and publishing the data.
Look forward to seeing it presented. All right.
Awesome.
Thanks, everyone. Okay.
Let's see, how do I?